You know, one of the coolest things about being an optometrist is that I was able to incorporate a special emphasis into my practice. Not only do I perform comprehensive eye exams for patients, but we specialize in fitting medical necessary contact lenses for patients who are suffering with keratoconus or who may have had a corneal transplant, or patients who may have had a LASIK procedure or any type of surgical procedure that didn't turn out the way that they expected. Keratoconus basically is a disease where the cornea is more shaped like a football instead of a round ball. And when light enters the eye, instead of the light entering the eye correctly to give clear vision, it is diffracted and distorted vision that the patient actually will see. A lot of times these patients are unable to be corrected with glasses or a regular pair of contact lenses. The majority of these patients need to be put in a medical necessary contact lens. There are some patients who are suffering with severe keratoconus, and those patients sometimes have to actually have a corneal transplant. After a corneal transplant, a lot of the times those patients still will have to have a medical necessary contact lens. You know, it really bothers me when I have a patient that comes in and they just burst into tears explaining to me the amount of friends that they've lost due to their visual disability, stating, you know what, Dr. Lenoir, I was out, I saw some friends, they thought I was being stuck up because I didn't recognize them, but they didn't understand that I literally could not see them. Or you have another patient that'll come in and say, Dr. Lenoir, you know what, I've been falling down so many times, I can't see. You know, that breaks my heart. I'm extremely passionate when it comes to treating these patients that have keratoconus. Many patients come in, they're extremely frustrated, sometimes they're even angry. But when I'm able to actually see those tears of frustration and anger and tears of losing hope turn into tears of joy, I mean, that really makes me feel like I have actually helped to change someone's life. I mean, literally. You know, I've had the privilege of helping many patients due to the kind referrals and the faith in those referrals from local optometrists and ophthalmologists in helping their patients. And there are many patients that I've been able to help, patients that may have experienced trauma to their cornea, patients that may have had a corneal transplant, patients who are suffering with keratoconus, or even patients who may have undergone a surgical procedure that may have produced an unwanted outcome.
In the early 1990s, I was diagnosed with keratoconus. For many years, the wearing of contact lenses was not a problem. However, as the keratoconus progressed, the fitting of contact lenses became much more of a challenge. I was referred to several local providers. The last one said it was time for surgery. It was time to consider a corneal transplant. I did visit with a surgeon, and he said we had another option, Dr. Marjorie Lenoir. She had built a reputation of being able to treat successfully hard-to-fit contact lens patients. So even as my vision progressed to a -18 and a -22, she successfully fitted me in a pair of hybrid contact lenses. Her dedication to excellence, her commitment to continuing education, meant that I was receiving the very best products available on the market and the most up-to-date products technologically. I'm still in contacts. I still haven't had surgery. If you find that contacts are becoming a problem for you, contact Dr. Lenoir. She's kind, she's patient, and she will not give up on you until you are successfully fitted in a pair of comfortable wearing contact lenses.
I was referred to Dr. Lenoir back in 2012 after being diagnosed with keratoconus and having to have a corneal transplant. By this time, I had seen maybe 3 to 4 optometrists all in 1 year, walking away with the same results, being fitted for contacts that were too uncomfortable, and not only were they uncomfortable, I could not see out of the contacts. Being diagnosed with keratoconus means that forever I would have medical necessary contacts in order to gain proper vision. By this time, meeting Dr. Lenoir, I was quite optimistic and still very frustrated, and also accepted the fact that maybe I would have poor vision for the rest of my life. But she assured me that not only would she get me fitted with the contacts that I needed, I would also be seeing 20/20. It's been going on 3 years now, and I have the contacts that I needed. They are so comfortable, and not only that, I am seeing 2020. I am so thankful and grateful to Dr. Lenoir, because most doctors come off as very intimidating, and it's kind of hard to ask questions about your needs when it comes to your health. She was very patient with me, she was very kind and very understanding, and above all, still very professional. Not only would I recommend Dr. Lenoir to my family and friends, but to anyone that needs a lifelong eye doctor that's very concerned about their health needs.